I would like to thank Martin Wakazu and his staff for the leadership they provide every day, whether it's our Food is Medicine initiative, where we're reducing health disparities one prescription at a time, or the results that you heard about with the vaccinations. In Alameda County, for those aged 12 and above, 92% have at least one dose. For adults, it's 96%. Total population, that includes those who are just eligible for vaccinations and even those who are not eligible, 85% at least one dose. Boosters are fully vaccinated, 39%. We've done this neighborhood by neighborhood, block by block, with trusted organizations in the community doing the testing, the tracing, the vaccination, and the outreach. We're going door to door, knocking on doors to help get people vaccinated, having the tough conversations with those who are not sure it's the right thing to do, and it's working. And that's vitally important because Omicron is spreading and fast. If you are not fully vaccinated, you're at a higher risk of getting sick, ending up in the hospital, and even dying. However, if you're fully vaccinated, and especially if you get the booster, you should be protected against severe illness. Get vaccinated and get boosted as fast as you can. Luckily, California has been preparing for a surge like this, leading with first in the nation public health measures and the most robust testing, vaccination, and booster programs in the country. Today, the governor is announcing further efforts to protect Californians and our healthcare system through this latest surge. Governor Newsom's decisive actions have resulted in California being labeled the safest state to live in during COVID-19 and a national leader in preventing school closures. We are fortunate to have leaders like Governor Gavin Newsom and State Senator Nancy Skinner of the state legislature who will be speaking next. Thank you.
Thank you, Dave. Thank you, Director Wakazu. I'm Nancy Skinner, State Senator for this area, Oakland, Berkeley, Richmond, beyond. And I am so proud to be in this beautiful clinic that has been providing essential health care to so many residents beyond just our Native American community. And when we were just upstairs, some people were getting their boosters. I talked to a woman who lives nearby, and she's been using this clinic as her primary health care for years, even before this beautiful building was opened in 2008 or so when it was down the street. And our community clinics are the lifeline of dealing with COVID here in our communities. They are the place where people can get tested, people can get their vaccinations, and people can be treated if they are to get infected. I'm going to take my mask off now. I'm going to take it off because I was just tested. Otherwise, I would not take it off. And why? Because masking is one of the most important things, not the most, but one of the most important things to do right now to slow this spread. Because when we are masked, we are protected from the virus entering our nasal cavities and such where we would get infected, and we are protecting others if we are infected from spreading it to them. What's the other most important thing? Vaccinations. Getting vaccinated, and if you've already been vaccinated, getting boosted. Most important. Why? Because as Supervisor Brown mentioned, Omicron, this current variant of COVID, is spreading rapidly. It is doubling in California right now. The cases from COVID are doubling every 2 to 3 days. And we've seen what happened in New York City. New York City's now closed their bars, closed their restaurants, more or less shut down Broadway and such because of how quickly Omicron has been spreading. We don't want to do that. And we can avoid it if we're all masked and if we get those boosters, because we don't want to spread it to our vulnerable people, to our little ones, 5 and under, who can't get vaccinated, to our grandparents. And that's really why we're here today. And as Supervisor Brown mentioned, California is doing great, and we want to keep it up. We're doing great because we have great vaccination rates, but we want to top everybody and get it completely vaccinated and everybody boosted. And we have one of the lowest death rates per capita. And that we also want to keep up. So even though you may not get as sick from Omicron and you may not be hospitalized, you could give it to someone else. No one deserves to be infected because we weren't smart and we weren't careful. And now, I am so proud to be able to introduce the great governor of California, Governor Gavin Newsom, and the reason that California is this safest state, and the reason that we have these high vaccination rates, and the reason that we've had these low death rates, and we've kept our schools open, is the leadership of the governor, making things like testing available, making vaccinations available everywhere, and spreading the word for the necessity, and doing the right things like requiring masking now, and various other things. So, Governor Newsom, I'm so happy to be your partner, and I'm so happy you're here.
I appreciate that, Senator. Thank you for the generous introduction. And Supervisor, it's good to be with you. And to Martin, it's always special to be with you. The Wakazu family means a great deal to me. Anyone that's followed a little bit of my time in public service knows how close Helen and I were. Who passed away a number of years ago, and she was a remarkable mentor, and she really led me on a pathway of discovery around drug policy reform when I was very, very young. And I'll never forget the time I spent with her, but moreover, I'm just so proud that she put me on that path, and proud that she lives on in this remarkable clinic, this community, and through your extraordinary work, Martin. So thank you for the privilege of allowing us here today. With that in mind, I want to pick up a little bit on what the Supervisor said and what our Senator said, and that is California continues to lead. As of today, we have the lowest positivity rate in America, 3.3%. As of today, you look at the 7-day case rate, we have the 6th lowest 7-day case rate in America. We continue to lead the nation in terms of administered doses of vaccine, and we continue to do more than most other states in promoting not only the safety and efficacy of our vaccines, but promoting the boosters, which we'll talk about here in a moment, and promoting the critical nature and importance of getting those, particularly 5 and 11, vaccinated as well, so we can continue our nation-leading efforts to keep our kids safely in person in school for the rest of the school year. More on that as well in a moment. That said, we are here mindful of what's occurring not just in the state of California, across this country, but around the rest of the globe, and that's this new variant. It is not lost on me that it was just a few weeks ago that Dr. Galley, who's here, and I were in Winton, California, in the Central Valley, announcing the first identified Omicron variant case in the nation. Here we are now, 48 states, let's disabuse ourselves, all 50 states have the variant, 48 that are publicly described as having it, 191 individuals, just 191 individuals formally we have identified with the variant in this state, but we know what you know, and that is the ubiquity of this variant is now taking over the Delta and presents itself all across this state and this nation. How do we know that? It's not just anecdotal. We know that because we trace and track the variant, notably through wastewater assessments that are done every day. Those assessments and that tracking, including the genomics that is done, second to none in this state compared to any other state, we now are tracking well north of 50% of all of the sequenced genomes identifying themselves as Omicron. In fact, tomorrow we will come out with an updated number, a bit of a preview Thursday. When we update that number, you noted that 73% have been identified across this nation. We have conservatively identified over 50%. We know it's well north of that, and that will be disclosed tomorrow when that data is put together in aggregate form and will be shared publicly. We're here as well, as the Supervisor noted and the Senator noted, because we've seen a significant increase in the number of identified cases of COVID. I'll put it in perspective. That's rather simple to understand. This time last week, we were at 2.3% positivity. Today we're at 3.3% positivity. They may not seem significant, but in percentage terms, that's a big increase in just 1 week. Last week, we had 5,400 cases identified. Today, just shy of 11,000 cases of COVID identified. So almost a doubling of cases in 1 week, and a positivity rate that increased substantially from 2.3 to 3.3%. So you could do the math on this and get a sense of the challenge that we all face here in the state, country, and around the rest of the world. We continue to believe in the absence of contrary data, though there is some conflicting data, that not only is the Omicron variant more transmissible, but it seems for those that have been vaccinated, and particularly those that have been boosted, to be substantially less severe than the Delta variant. But the caveat is for those that have been vaccinated, and in particular those that have been boosted. And so our goal is to continue to get people vaccinated. The most important shot remains that first shot, and then the most important shot for those that have received at least the J&J vaccine or 2 doses of the Pfizer or Moderna is to get boosted. It is increasingly clear, though it's not formalized, and we are not at this stage formalizing it in the state of California, that the full dosing is a 3rd dose. And that's why the booster is so important, and we're here to promote our boosting efforts here in the state of California. 8.7 million Californians have received at least a dose of a booster. We need to increase that number if we're going to hold the line and decrease the growth for hospitals and our ICUs. We're roughly about 3,600, just shy of 3,600 people hospitalized today. I'll remind you that January 6th of last year, or rather this year, we had just shy of 22,000 people hospitalized. 22,000, roughly 3,600 within a period of just a few weeks of where we're standing today compared to last year. So we're holding strong, mindful, though, of these growth rates and these trends. And so we can't take anything for granted. And we're here to promote not just boosters, promote new strategies, 3 specifically that we wanted to discuss briefly here today. Number 1, nothing more important when we're experiencing a surge in growth of case rates than protecting our frontline heroes and employees. And that's why we led as the first state in the nation to require all healthcare workers to be vaccinated. And we're really proud of those partnerships, our providers, remarkable support we received from organized labor as well as community clinics, not just our hospitals, that supported that effort. And that led to extraordinarily high vaccination rates for our healthcare workers, kept staff working, kept the morale strong, kept their immunity strong. But we recognize now that just being vaccinated, fully vaccinated, is not enough with this new variant, and we believe it's important to extend this requirement to getting that 3rd dose, to getting boosted. And so we are formalizing that. February 1st is the deadline to get that done. And I again want to just thank all our partners. We worked hard to get feedback and to organize this framework for their broad support in this space. I think it is a smart move. I think it's the wise move in this context, that we need to make sure we don't have staffing shortages. We need to keep all of you healthy and safe. And again, the best way to do that is to get boosted. By the way, for those that wondered why we put out an executive order a few weeks ago, we did it in anticipation of this moment. We created some waivers, some flexibilities for our hospital system and our provider network, some decompression strategies, but we also allowed for contracted staff. We have 1,700 contracted staff in the state of California already to prepare for this increase. We have 500 more individuals that we have secured that are not yet into the state of California, and they're supporting 120 providers in the state. That was one of the purposes of extending that executive order. Again, all in an effort to prepare, not react, but to prepare for the moment we're in and the moments that present themselves in the very near future. We also believe that our most important agenda must be to continue our nation-leading efforts to keep our kids in school. And I just think it's an important point. Not only do we have 53% less deaths, and I appreciate, Senator, your reference to death rates than places like Florida, but Florida is not keeping their kids in schools because many of them are shutting down because of outbreaks, like the state of California. I don't highlight that to pick on Florida, but there's a sort of meta message that utilizes the Florida example as the more appropriate example. But if you believe that deaths matter, you believe that pediatric hospitalizations are of concern, and you believe that shutting down schools is suboptimal, then you may want to look at the approach states like California have taken. And that's why I was very pleased that we put out a statement today from all of our school partners, from superintendents to teachers to those representing our janitors, our bus drivers, unanimously came out with a statement today affirming our commitment to keep our kids in person instruction and to keep our schools open. I do not want to see our schools shut down. And I'm very grateful that all of our partners in education put out a statement amplifying that message. So that there be no doubt, that is our commitment, that is our priority, and in order to advance that priority, we are committing to the second point that I wanted to highlight of the three today, and that is after our kids have enjoyed the holidays with family, friends, safely, we hope, traveling in many cases, we want to make sure they come back in as good a shape as they left, meaning we want to make sure that we are testing our kids and preparing them to come back in-person instruction. And so we'll be sending out, we are ordering 6 million tests, no charge, and we're going to be sending those out to our partners all up and down the state to allow for priority access for at least 1 to 2 tests before our kids come back into school, so they have access to antigen tests and or PCR tests, but primarily antigen tests, so that they can get those results back quickly and make sure when they go back into person, they're doing so safely, knowing that they have not contracted the disease over the holidays. So that's the second announcement we're advancing here today. Number 3, we want to extend hours of operation for our nation-leading testing efforts. Let me be more specific. Based upon the federal government's own assessment, 20 or so thousand testing sites exist in the United States. We know for a fact California has 6,288, which puts us a little over 30% of all of America's testing sites are operational here in the state of California. That's why you're not seeing the long lines necessarily in around blocks like other cities and states, because we have access that's quite ubiquitous. In fact, we've been able to determine that 90% of Californians, and remember this is a state larger than 21 state populations combined, a lot of rural and remote parts of the state, 90% of California residents have access to a testing site that is within 30 minutes of their home, 60% within just 15 minutes of their home. We have 257 OptumServe partners, and we are working with them to extend the hours of operation, to expand them, particularly where there is high demand and there's some bottlenecks. And we're assessing that and working in real time. So we're also looking to expand the hours of operation to provide more access to testing in the state. I noted that we're going to be purchasing 6 million new tests for our kids. That builds on what we've done since August 21st. Where the state has procured 12 million tests, providing them to community-based organizations like this, clinics large and small, hospitals, schools, and local health departments in this state. And that's just highlighting the fact, again, we're not reacting to, we've been leaning in on this testing frame. So, look, I recognize, as I've had family members say, boy, I was just down at the Walgreens and CVS, they were out of the over-the-counter. I reminded them, they go to My Turn, just Google My Turn, you will have a list that is proximate to your home availability for free testing. And you can learn about testing exists here, and testing exists throughout the state of California, if indeed the supply chains at the pharmacies and retail are a little bit behind, that you'll still avail yourself and have the opportunity to access that testing. I just want to remind people of that. And not many, not a lot of us can afford those tests at Walgreens or Safeway and the like. And so, again, My Turn has culturally competent information, many different languages. You can actually access not only locations, but you also can make an appointment on that platform as well. If you need more information, you go to the covid19.ca.gov website. That ca.gov confuses everybody. If you just Google My Turn, I think you'll at least have the access that provides at least baseline information that will help you on the way. So those are the three announcements here today. Get that third shot, get that full complement of vaccines for healthcare workers and nursing home staff to make sure that we are prepared to get our kids back in school. 0.3%, by the way, 0.3, that's 0.3% of the nation's school closures, even though we have 12% of the nation's student population. There's been 9,600 schools that have shut down in America, just 32 in the nation's most populous state, because we've led with health. We've led with vaccination efforts, and we're leading with masking, as the senator said, which is so critical, as well as the most important non-pharmaceutical intervention we can advance besides common sense in terms of addressing this virus. So again, as I am often prone to be long-winded, forgive me, but this is important to share this information. And I'll just close, as I often do, reflecting back in the last year and a half. The one word is humility. We don't know what we don't know. Humility. Can't be ideological. Must be open to evidence, argument, and be willing to iterate in real time. And so I'm mindful at this moment, with the nation's lowest positivity rates, the 6th lowest case rates, that can change in a matter of days, not just weeks or months. And at the end of the day, nothing we do here at the state or even in Alameda County, which is doing an extraordinary job, matters compared to what you do and the decisions you make at home. And so I want to remind everybody of the power and potency of your day-to-day decisions in terms of our fate collectively and our future as it relates to this virus. And remind people to be safe, to spend time with their loved ones, but to do so thoughtfully, considering what we're facing and knowing of our resilience and our capacity and resolve to get this behind us. We will get this behind us. I know you're exhausted. We're all exhausted by this. But we have something we never had in the past, and that's the power of these life-saving vaccines and the power to get boosted to get through this arguably 5th wave of this pandemic and get closer to that day where this pandemic becomes an endemic and we manage it as we manage so many issues in our state, in the world we're living in. So that, we're here to answer any questions.
Question in the back, in the mic. Yeah, go for it.
Governor, thank you for visiting today. My name is Keith Burbank. I'm with Bay City News. I was wondering, could you just comment, or I'm wondering if the requirement for the booster for healthcare workers is too restrictive, and what would you tell healthcare workers that are, kind of on the fence in terms of getting a booster? Please.
I tell them, first of all, thank you for their extraordinary sacrifice. The burnout rate for our healthcare workers is off the charts. I can't tell you how many remarkable healthcare workers I've met who talk about not being able to unsee what they see. And that takes a toll. To be there where no other loved ones could be there at the last breath of someone they're trying to save because of the contagiousness of their condition. and being there for those individuals, and taking their own iPads to do FaceTime to allow someone to say their final words. It's on a ventilator to their loved ones. And so, number one, I'd say thank you. Number two, I also want to extend appreciation for the fact that when we were the first state in the country to require this vaccination mandate, the overwhelming majority of them complied. And as a consequence, we are outperforming in terms of the number of staff, critical staff, that's actually able to continue to do their extraordinary life-saving work every single day, meaning they're not dialing in sick because their immune system has been boosted because of the vaccines. And then finally, I'd just remind them, let's not run the 90-yard dash. The data is overwhelming, it's clear, evidence is in, 2 doses is great, the booster is a game changer, and that 3rd dose is needed. And no group of workers understands that perhaps more than our frontline healthcare workers. And so I would just ask them to continue to lead by example as they have, and thank them for that example and modeling good behavior.
Thank you.
Thank you.
Governor Lizzie Nutri with KCRA out of Sacramento. What are you going to do about school districts that say they refuse to require the vaccine of their students, or even school districts like Sacramento City Unified that's requiring it early but has seen really low vaccination rates among its students?
Well, I continue to work with school districts, large and small. I'm grateful and pleased with the overwhelming majority. I don't consume myself with the exceptions, the extremes. But the overwhelming majority that are not only in compliance but are working as partners to provide insight and to support accountability and transparency in terms of keeping their kids safe and in person. I'd also remind them that many of these districts that don't like the vaccine mandate, that they require a vaccine, and they are mandated, those same districts and those same leaders, for 10 other vaccinations. And I want to thank them for their high compliance rates for measles, mumps, whooping cough, and other things, and encourage them to consider 11th. We'll wait till the FDA fully approves it, and then it goes into effect. So it's not in effect right now. We provide common sense exemptions, medical exemptions, and religious exemptions. Currently, there's a personal belief exemption, but again, it's not even in effect. Some have decided to move forward earlier. Some have decided to modify that. LA Unified is an example. And I want to just express appreciation for recognizing local conditions. There's 1,050 or so school districts in the state, different challenges, different issues, different student bodies, different considerations across the spectrum. And that's why we're not getting in their way in terms of making those local decisions. We just want baseline considerations to be met, and that's why we put out, after FDA full approval, our policy. With that in mind, there are a few exceptions. There's been a few exceptions on counties and sheriffs throughout this pandemic. It's part of the work we do.
Are there any repercussions, though?
Well, health rules are health rules. The rules are the rules. If you don't vaccinate for measles, mumps, you don't vaccinate across the spectrum. There's well-established rules that go back decades, many decades. They're not dissimilar to the rules we're applying. And so all of these folks know that well. Their eyes are wide open. And everybody has the freedom to make their choice. But choice is often, it's not the freedom to do something, it's the freedom from consequences as well. And so there'll be, as there was with counties, we send letters. We work with them. We try to address their anxieties, concerns. The vast majority, we're able to work together and figure out. And I am absolutely confident the vast majority will figure out in this case. If there continues to be a problem, then I'm not going to color in the exceptions. I'm going to color in those doing the right thing.
Hi, Governor. Brooks Jarose, KTVU. I wanted to get your opinion on, first off, if we see this large surge and we have more cases, the CDC is considering, if someone gets sick, reducing the quarantine time from 10 days to 5 days. Wondering if you're in support of that. And secondly, if that doesn't happen, are you concerned that teachers or healthcare workers may be out sick, and could that have a negative effect?
Well, I have just the right person to answer that, and that's my doctor. Your Dr. Fauci, our own doctor, Dr. Galley.
Thanks, Governor, and thanks for the question. We've been in contact with the CDC about exactly this, understanding the evidence, the information. I think as we've been talking about it, as we move through this pandemic, we've learned a lot. We started at 10 days. We started to talk about what does it mean if you're fully vaccinated? Does that change your quarantine period? What happens when you have a masked person who's exposed? All of these things go into that decision. So I think the science is clear. Right? We can do some things different than we were before, and I think this adjustment potentially is reflective of that science. And so as the CDC maybe moves in that direction, we are supportive. We're weighing in. We're sharing our own thoughts and evidence on how it would impact California, and believe it would be a real important change to the way we've sort of been impacted by this pandemic. But I don't want to erase that what has gone into that thinking is the fact that we're getting more Californians, more Americans vaccinated, that we're getting more people boosted, and that level of protection, that blanket of protection around people in California allows us to do that with some confidence. This also has to do with the fact of how the virus has evolved, these different variants, how they transmit, their life cycle, and that instead of 14 days down to 10, potentially down to 5 now, it's reflective of our understanding on how the replication of the virus is occurring today versus when we had those original strains last year.
This is Victoria Colliver with Politico. So I know today's announcements on healthcare workers, but will other categories of Californians who are required to get vaccinated, we're taking state workers who of course have a testing option, schools, I mean, will this then expand to others?
Well, I think as you've seen over the last year and a half, again, there's a recognition that you need to meet the moment and anticipate moments into the future. This moment, no, at this moment. But we game a lot of things out. We have projections as it relates to this variant. We had projections that related to the Delta variant, and as you know, we had over a dozen other variants we were monitoring, including our own homegrown West Coast variants. And so we went through those scenarios, and we will be considerate of subsequent decisions in the future. That said, this moment, focus on our kids. Let's prepare our workforce. That's a concern. Workforce, keeping them healthy and safe, keeping our kids healthy and safe, and see where we go. We continue, we're an employer. We have responsibility. I'm not naive. We're one of the largest employers, not only in the state, but the country. And I think we're up to 76, not where we need to be. 76% of folks getting tested, 74% being vaccinated. Want to get those numbers up ourselves, so we've got our own work to do in that space. Continue to work with all these other rules and regulations with our partners, again, being mindful of changing conditions. So forgive me for being long-winded to say not at this moment. That's a succinct response, and hopefully we won't have to consider that if all of our interventions are successful.
Governor, Kathy Novak from KCBS. I'm the last question. Do you foresee a time when you'll be able to, or when you will be sending test kits home with school kids more regularly, not just when they're coming back from a break like now?
Yeah, I mean, we've been talking to the CDC, the Biden administration. They're 500 million tests. That's a good start. It's a supply issue at the scale that would be necessary to provide the numerical number of tests. But look, we're doing a down payment on that with these 6 million. We hope to get them out, work through the logistics of doing that. That's an issue itself. And I hope we'll get to that point where everybody has access to low-cost antigen tests, the minimum, and low-cost PCR tests with turnaround time within 24 hours, not 36 or 48, as is the case. And we continue to promote those efforts with the Biden administration and our partners, for that matter, around the globe. And Dr. Galley perhaps spent a little more time with you on those conversations, as California is one of the leading states in terms of the research and development and manufacturing of a lot of the components of these tests, and we want to continue to accelerate that inevitability in terms of the ubiquity and access to testing. In the meantime, though, I'll remind people in closing, over 6,288 testing sites do exist in the state of California. About 2,600 of them are PCR, the rest antigen testing sites. We'll be expanding hours for many of these testing sites. If you go to My Turn, you will learn about access and proximity from your home to these free testing sites. Meanwhile, 6 million new tests are being purchased, will be sent out, and to points of access that we're working through logistically to prepare for our kids to come back in person in the now January. What is that? I mean, I could call it fall, but we're in the fall season, and continue our efforts to keep our kids in school. Again, I cannot impress upon you more how important it is to keep our schools open and how important it is to get our kids tested, vaccinated, and continuing our mask requirements in order to do so sustainably. Thank you all very much for your time and attention. Again, Martin, thanks for having us here today.